RFK Jr. just presided over sudden, massive cuts gutting the federal health department, leaving the people at the agency scrambling to figure out what will be left standing. Remaining employees are left wondering if our national drug supply is safe and if we will still be equipped to handle a disease outbreak like the preventable measles fiasco in Texas. Staffers at HHS and lawmakers on Capitol Hill, they learned about the purge from an article in the Wall Street Journal. 10,000 workers, elimination of entire departments, and shuttered regional office are just the latest casualties of the ready, shoot, aim approach of Musk and his minions. Now, it should be noted that these layoffs come on top of the roughly 10,000 employees that had already been left out in the dark in recent months among pressure from RFK. Now, the perversity of eliminating a quarter of our federal health staff is that experts believe that this is actually going to end up costing the federal government money in the long run. Now, those in the know, they are chilled by the fear that critical services will be compromised. One member of the FDA told the Washington Post that he wouldn't trust a single drug approved by his agency going forward. The prevailing worries are that consultants with no working knowledge of the agencies, they're the ones driving these cuts, and that they're delusional to think after firing tens of thousands of staffers that those people will simply just come back and be rehired if their jobs are discovered to be critical. Moreover, by killing the preparedness and response unit, they are inviting disaster by not readying for what could come next. Now, this is, of course, not happening in a vacuum. Kennedy, a longtime anti-vaccine activist, as you know, has already contributed to the spread of measles, and with the expanding bird flu concerning experts as a possible pandemic, RFK has publicly floated the idea of letting the virus run wild among our nation's flocks. You can't make this up. Cancer research, for reasons unknown to any rational human, is also suddenly being prioritized for being gutted. Despite broad bipartisan support and an unquestioned record of success, RFK and Musk have abruptly ended life-saving research for pancreatic, kidney, and lung cancers. Going even further, they've ordered that the NIH is to terminate hundreds of research awards that pay for critical trials. The consequence is either bad or worse. Without funding for clinical trials, scientists will either give medical guidance without evidence or, more likely, not be able to give guidance whatsoever. Sickeningly, these studies have been particularly targeted by the Trump administration, and they all have something in common. These grants all targeted populations at higher risk of worse health outcomes who have been traditionally and historically neglected by both science and medicine. When you put this all together, a frightening combination's been created. Indiscriminate cuts to the front lines of our federal health defense, skepticism of science and medicine from those tasked to protect us, and an agenda to leave unprotected the very people who need the most help. Whatever the opposite of the Hippocratic Oath is, we're looking at it.